with the AIDS Foundation of Chicago. Thank you so much for joining us on today's webinar, Enrollment 2.0, Helping Consumers Get Covered and Stay Covered. So today our great partners at Enroll America are going to be presenting information on renewals, redetermination, some new health literacy information, and also best practices for those enrolling individuals on the ground. So just a few housekeeping issues before we get going. You can use the question feature to ask questions during the webinar at any point. So everyone is in listen-only mode, but you can ask a question through the chat function, and either someone will get back to you personally, or we may ask them to the general crowd and the panelists, and we can cover that during the Q&A session. If you are unable to hear the audio, you can use your telephone. So click the audio tab that on the Citrix panel that you can see on the right of your computer. Click on the audio tab and dial in using the telephone number, access code, and PIN, and then you can watch the slides on your computer. You can also download the slides. Go to www.hivhealthreform.org. And then you can also go to hivhealthreform.com to access old webinars and recordings that we've archived. Please follow us on social media. We are going to be live tweeting this webinar and ask that you please join us in doing so to get the conversation going and get this information out to others within our communities and organizations. We will be using the hashtag #GetCovered, hashtag #StayCovered, hashtag Enrollment Year 2, hashtag ACA, and hashtag HIV. We would also love for you to follow us. Our Twitter handle is down below at HIV Health Reform, and also on Facebook. Also, we ask and encourage you to check out HIV Health Reform. This is a website that AFC has developed and maintains. It has the most up-to-date information on ACA-related enrollment specific to the HIV community, and it is constantly updated with tons of resources, information. All of our webinars are there, so we strongly encourage everyone to check out www.hivhealthreform.org. And lastly, we ask that people speak up. And so this is another project in conjunction with the HHR website, and this project helps us monitor and assess both successes but also barriers and issues that individuals have when trying to access health insurance for their clients or patients, or if they're having trouble within their states, they're seeing troubling trends, perhaps discriminatory and problematic trends happening within their state or communities. So we ask that you go to hivhealthreform.org/speakup, and you can tell us about these issues with a short form that you fill out. We will receive that, as well as our partners at Harvard Law School, and together we will work to address these issues both in your community and in a systemic and perhaps legal way, and we would love to gather as much information as we can to address these issues. So today's agenda, we are going to start with Jennifer Sullivan, then followed by Sophie Stern and David Elin, all from Enroll America, who are going to talk to us about renewals, health insurance literacy, and best practices on the ground, then followed by a Q&A. Between each section, we are going to take maybe a 5 to 10 minute section and address maybe 2 or 3 questions that folks have asked that pertain specifically to the information provided in those sections before moving on. Then at the end, there will be a general Q&A as we do on every other webinar. So on that note, I am going to turn it over to Jennifer.
Great. Thanks, Molly. Can you hear me all right?
Yes, we can, Jennifer.
Okay, terrific. Always want to do a sound check before I get too deep into things. Thanks so much for having us here this afternoon. We are happy to be here, and we're excited because we have seen the first couple days of open enrollment go really well, which is a change from last year and one that we have worked hard to see and are excited to see. So for my portion of the presentation this afternoon, I just wanted to really set the enrollment landscape. Obviously, there are some things that are the same about this year, this time around, and there are some things that are different, and I really wanted to make sure that everybody is on the same page with that before we dig a little bit deeper about health insurance literacy and best practices for actually reaching people on the ground. So this time around, there are a lot of things, as I mentioned, that are staying the same. Number one, first and foremost, always on our list is the importance of emphasizing financial help. Financial help was available last time to help consumers afford coverage through the marketplaces, and it continues to be available this time around. We don't suspect that the recent news of the Supreme Court taking a case related to financial help will affect things too much. That hasn't penetrated sort of the general consciousness, but there could be confusion out there, and we always want to make sure that we're emphasizing that financial help is available through the marketplaces. The populations who are likely to be uninsured. We made a lot of progress over the last year with some notable declines in uninsured rates both nationally and among specific target populations, but there are groups like African Americans, like Latinos, like young adults who are still more likely to be uninsured than the general population, and because of that they are some of the groups that we're working the hardest to make sure have the messages and the information they need to enroll. We found last time around that, and you'll hear more about this from some of my colleagues, that in-person assistance is really crucial. Individuals who got in-person help were twice as likely to successfully enroll compared to those who didn't. So we are going to be continuing to push of getting in-person help with somebody, some tools to help them connect to that help better in their community. The core message of the value of coverage continues to be important. Most consumers who are uninsured aren't doing that because they don't think insurance is important. But we need to remind them that it's available, that it's affordable, and how to get it. Yes, there will be some technology bumps, although I'm happy to say on the other side of November 15th, we didn't see nearly the bumps that we expected, either at the federally facilitated marketplace or in state-based marketplaces that have started to roll out their new systems. Things that tend to be going relatively well so far, but certainly as we get deeper into things, see how these renewals are working and how those transactions are actually panning out, there may be some bumps and there'll be some learning curves in there that we're prepared to be nimble about. And then finally, of course, and you'll hear lots of ways that Enroll America will serve as a resource for all of the work that you're doing over the next few months. Now, there are some things that are changing this time around, and I'll be talking more in depth about these as I get through my slides here. But just to quickly hash through them, we do have a shorter open enrollment period this time around, only 3 months instead of 6. We're dealing with renewals for the first time. We do have some changed messaging around the fine, the penalty for not having coverage. That is going up for folks that don't get covered during 2015, so that's an important thing to share with consumers. Some states will be expanding Medicaid who hadn't done that during the last year of open enrollment and over the summer. So that's exciting and something that we'll be working to get the message out on in those states. Who the in-person assisters are in an individual community certainly changes, whether it's individuals getting Navigator grants, IPA grants, or new individuals and groups stepping up to the plate to be certified application counselors. That landscape is always a little dynamic, and we've got some great tools to help you find out who those people are in your community this year. Training for assisters, we're doing more training for assisters so that assisters are equally well-versed in application assistance and outreach and messaging. Certainly funding is an issue. Groups don't have necessarily quite as much funding this time around as they did last year, and they are being asked to arguably do twice the work to both help people renew and connect new people to coverage. So that will be finding creative ways to do more with less is always a theme of the work we do. And then finally, coming up this spring, we will start to see some intersections between the coverage folks are getting through the Affordable Care Act and some of the implications when people file their federal taxes. So we'll talk just a little bit more about that later as well. So that was a grand overview, but now let's get into the meat of my slides. So I wanted to start with something that you may all be thinking, which is, gosh, doesn't this get a lot harder this time around? We got a lot of people covered, and that is the good news. The uninsured rate is definitely going down. A number of credible sources have found that that is absolutely the trend around the country, thanks to all of the excellent work that partners like you are doing. But that does mean that it can be harder to find the remaining uninsured. And we'll talk a little bit more about how the remaining uninsured are different a little bit later in my slides as well. But the good thing is that we have messages that work, and as long as we are working together and coordinating, and your presence on this webinar shows your willingness to do that, which we thank you for, we can do really good work together during this open enrollment period. Next. So let's start with talking about what the important dates are for this open enrollment period. I mentioned that it's 3 months long. It started Saturday and runs through February 15th of next year. Of course, Medicaid and CHIP enrollments are open year-round. There's no open enrollment period for those programs. If people are eligible, they should apply at any time. Special enrollment periods continue to be in effect even as open enrollment takes place. If people have a situation where they have had a qualifying life event that might allow them to enroll in marketplace coverage, they should do that, and they'll be screened for that when they apply for coverage through their marketplace. But that's also true when enrollment is closed. And then finally, just some key dates on tax filing. We'll start to see people file taxes as early as January 31st. That's when the forms will be in folks' hands. And because they'll be getting information related to their 2014 health coverage as part of their tax filing process this spring, during those last couple weeks of open enrollment, there could be some confusion, and we want to make sure that people understand what's going on in the tax side of things and how that does and doesn't affect their enrollment experience for this year. Next slide. Now, much like last year, we're following the same sort of formula for coverage effective dates. If somebody enrolls at a 15th of the month, then their coverage will be effective the 1st of the following month. So for those who enroll during the first month of open enrollment, their coverage for 2015 will start right away on January 1st. For those who take a little bit longer to enroll, as you can see, their coverage effective dates will be later in the year. As long as somebody gets covered by February 15th, then they will not face that fine for not having insurance during 2015. And but the sooner they get enrolled, we know that the better, so that they have coverage for a longer period of the year. Now, next slide. As we look to this open enrollment period, we knew that we really had to walk and chew gum at the same time. We needed to focus really hard on getting new people to know about their coverage options and enroll in coverage, but we also needed to work really hard and are working really hard to make sure that those who enrolled last time keep their coverage. And for those who enrolled through the marketplace, there are some really important steps that they need to take. Now, when we started to think about how we were going to approach this work, we thought, well, maybe we need to come up with two different messages. Maybe this is really walking and chewing gum at the same time, and different populations require different actions. But as we took a closer look, we really decided that the same messages are true for both populations. We need them to get covered. We need them to stay covered. And if they take the same action steps, they will be able to navigate their way through the process, whether they're getting coverage for the first time or whether they're renewing some existing coverage. So we came up with this graphic that you see in front of you now. It's split in half. It looks much nicer for social media purposes when it's all glued together as one piece. But it really tries to convey to the consumer the need to take action without unpacking all of the complex policy issues that underlie why they need to take action. It encourages consumers to check out their options because things like the amount of financial help they may qualify for next year, the doctors, hospitals, and prescriptions that might be covered, and their plan choices and the cost of that coverage might be changing this year compared to what they're enrolled in for 2014. So the simple steps they need to take are to log into their account, make sure they update their information so they have the right estimate of financial help for next year, check what plans might be available to them, shop for those plans, and then either re-enroll in the same plan if they're happy with what they've got, or shop for a better plan if that's the case. There might also be individuals, probably a lot of individuals, who as they report changes in income may be shifting from marketplace to Medicaid coverage or from Medicaid to the marketplace. And we want people to be updating their accounts and getting that information in there as well, which is why it's so important that you actively take steps to renew your coverage. Next slide. Now, I really wanted to dig in at this point and talk about some of those complexities that are happening under the surface that we don't necessarily think it's important for consumers to understand, but that it's important as all of us as partners working on this work for us to understand. Number one, things are happening with consumers, right? They are changing all the time. They are getting married. They're moving. They are having kids. They're having kids move out of their house. Things are constantly changing. Whether they are changing jobs, their income is changing, it's a dynamic situation, and their healthcare needs might also be changing. They need to be reporting those kinds of changes to the marketplace so that they make sure they have the right plan that works for them. At the same time, plans are changing in the marketplace. The way that an individual's financial health is calculated is based on a relative factor. It's based on the second lowest cost silver plan available in their marketplace. Well, every year, obviously, that dollar amount or that benchmark plan changes, and that has an effect on the dollar amount of financial help that somebody would qualify for even if nothing is changing in their household, even if they are making exactly the same dollar amount. Maybe they're on a fixed income and they know they'll make the same thing in 2015 that they did in 2014. The amount of financial help they qualify for could still change, which is why it's absolutely crucial that they get onto the marketplace, report those changes, report their situation, and then check out what that means for their financial health this year. At the same time, there are new plans entering the marketplace. Plans are changing their premiums. They might be making adjustments to provider networks or cost-sharing arrangements, all of which are really important for the consumer to understand before they make a decision about what's right for them in 2015. Now, at this point, I wanted to transition over to Molly to talk a little bit more about what this specifically means for the HIV/AIDS community and the population that you all serve.
Thanks, Jennifer. So again, this is Molly from the AIDS Foundation of Chicago, and I briefly wanted to touch on the general subject that we're talking about, specifically in terms of what this means for those living with HIV. Individuals with HIV should evaluate new health plans offered on the marketplace, as should everyone else. There are some specific implications for those with HIV and the plans that they may be currently enrolled into. So new plans offered on the marketplace may have broader provider networks, which may include more HIV providers. They may have lower deductibles and out-of-pocket costs, and they may have more affordable prescription drug coverage, especially for expensive HIV meds. And perhaps most importantly, with plan renewal and ADAP coordination. So many states have ADAP programs that will help pay your premium and also cover your medications. However, to qualify for this assistance, one needs to be enrolled into a plan that is compatible with your state's ADAP program. And so first of all, I want to say that each state's ADAP and Ryan White programs are different. So if you have any questions and would like to know the specifics of your state, we encourage you to reach out to your local ADAP or Ryan White office and inquire about this information. So if individuals are enrolled into a plan right now that it will no longer be offered in the marketplace for this next open enrollment period, if this consumer does not take action, they don't open their mail, they don't go back to the marketplace, they don't maybe choose a new plan, the insurance company, you will be auto-enrolled into a plan that is deemed substantially similar. However, this plan may be in a different tier than the consumer's previous plan, and this may knock someone out of the ADAP program or Ryan White program because ADAP or Ryan White might not work with that tier of plans. So here in Illinois, ADAP works with silver, gold, and platinum plans. However, they don't work with bronze plans. So if someone didn't take action and they were knocked down into a bronze plan that was deemed to be similarly substantially similar to the plan that they were previously in, then they would no longer be eligible for ADAP assistance. So obviously this has serious implications for those living with HIV who may, again, unknowingly be enrolled into a plan with very poor drug coverage, very expensive drug coverage, unaffordable co-payments, or a plan, again, that may disqualify them from receiving outside assistance. So to this point, and to Jennifer's point, well, we encourage everybody to take action, to not be passive in this re-enrollment process. But for those living with HIV and for organizers, navigators, and providers who may be helping individuals living with HIV navigate this process and perhaps renew their plan, we can't stress enough how important this is. Again, we want to make sure that a person is enrolled into a plan with medication costs that they can afford, and that would be that would qualify them for any Ryan White or ADAP assistance that they may receive. So I'm going to hand it back over to Jennifer at this point, but again, a big takeaway from this is I would encourage everybody who has any questions about their state's Ryan White program to call their local office and ask these questions. All right, Jennifer, I'm going to throw it back to you.
All right, got it. So let's talk a little bit more about what that process actually looks like for the consumer. They're going to receive, and we'll talk about that in a moment as well, they're going to have received some notices in the mail. They will likely have heard, if they're enrolled in marketplace coverage, they'll likely have heard from their marketplace as well as from whomever was issuing their coverage during 2014. Now, those notices won't, by definition, say the same thing. They will have different information about financial health and about the cost of coverage, and a lot of consumers are likely going to be confused by that, which is why we're really hammering home the importance of in-person help and being there to support consumers through the process. But let's assume that they do take that step that we want them to take, which is to log into their marketplace account. They're going to go through, and the information I'm sharing here is relative to federally facilitated and partnership marketplaces, those states using healthcare.gov. If your state is using its own marketplace, this process will likely look a little different. But if you're using the healthcare.gov interface, then they're going to advance through a pre-populated application. They're going to log into their account, and they're going to see the information they put in the application last year. And as they advance through those screens, they should update the information that's changed. Then they're going to submit that information, and then on the website, they should be able in real time to get a new eligibility notice. It'll just be that new PDF that you download that tells you how much financial help you may or may not qualify for. From that point, you again advance to the shopping screen, take a look at what's available in the marketplace this year, and if you want to choose a new plan, they can choose a new plan, obviously. If they want to keep the same plan they had last year, they're going to need to take a really close look at how they find that. That's not automatically going to pop up and say, you know, do you want to keep this plan or find a new one? You're going to have to actively look for that plan, find it, select it, and re-enroll in it. And only after that step, when you choose a plan, are you covered for 2015. So we want to encourage consumers not just to update their information and get that new determination, but then to actively select a plan that they want to enroll in for 2015. If they don't, they're just going to be treated like sort of the auto renewal population. And I don't even talk a lot about this, but what's happening in the background for folks is that if they don't take action by December 15th, then they will be, as Molly alluded to, re-enrolled in a plan, the same plan that they had last year or a similar plan with the same dollar amount of financial help they got in 2014, but that's not going to land many people in the best situation for them financially, which is why taking action is so important. Now, for those who are changing plans, they get through that process, they decide, gosh, there's a better plan in the marketplace for me this year, I want to change plans. One tip that we're recommending is to go ahead and call your plan from 2014 and actively let them know that you're canceling coverage and make any necessary changes to any auto payments that you may have set up to pay your premiums for your 2014 coverage. That back-end system is not necessarily working perfectly yet. We aren't exactly sure how well it will be working over the next few months, and so this is just one extra step to make sure that consumers don't get a bill for a plan that they're no longer enrolled in. Next slide. So this really, I basically already covered this, but this is just a reminder that consumers are going to get a lot of different notices from different parties, and they may not have the same information, which is why they can expect some confused consumers seeking out help this time around. Now let's talk a little bit more about Medicaid renewals. The story is much shorter here, but Medicaid coverage is good for 12 months. People have to report changes throughout the course of the year, but assuming nothing changes, they stay enrolled in their coverage for 12 months. But at the time that they come up for renewal, the process is going to look different in each state. Now, the Affordable Care Act requests that Medicaid agencies make this process easier, and really if the agency has enough information about the individual to renew them automatically, that they do that. But if that's not possible, they are going to reach out to the consumer, ask them to update their information or confirm the information that they have in the account so that their coverage can be renewed, or if necessary, transition them to another program. Next slide. Now I want to talk a little bit more about messaging, and part of the message requires us understanding how the fine is working this year. We did find last year that the fine was an important motivator for folks, not because they were necessarily looking at the dollar amount and going, gosh, this is more expensive than coverage, and so I don't want to pay the fine, I'm going to enroll in coverage, but they were looking at it and saying, I want to follow the law, and this is that extra sort of push that gets me over the edge and gets me to get up, take action, and get covered. So last year it was $95 or 1% of annual income, whichever was higher, and this year that's going up significantly to $325 or 2% of income. Now, there are definitely significant groups of consumers who are exempt from the fine, but we want to make sure that consumers understand the implications of potentially facing a fine if they don't get covered next year. Because again, that's just that sort of extra push they might need to get up and take action by the 15th of February. Now let's talk a little bit more about the consumer. All of this is swirling in the background, but, well, how are they seeing the second open enrollment period? Well, number one, they're not, right? They're not thinking about things in the same terms that we all are. But the important thing is that consumers that know more take better actions and do better in terms of doing the things that they need to get coverage. Those who know more are more likely to enroll and to keep coverage. So going into the second open enrollment period, we saw a Kaiser study that came out last month found that 90% of the uninsured were unaware of when open enrollment began this year, or begins at the time, and over half didn't know that financial help was available. And one thing that we learned last year as we compared those who enrolled to those who didn't was that one of the major barriers that prevented people from successfully enrolling was the perception of unaffordability. This wasn't that consumers logged in, shopped their options, and then said, these are too expensive for me, I'm not going to enroll. They just assumed health insurance has never been affordable to me before, and so why has anything changed now? That's why those messages about financial help are so crucial. But as we can see, we still have our work cut out for us if over half of the uninsured still don't know about financial help. The good news is that they do value having insurance. The same survey that found that people were pretty uninformed going into the second open enrollment period also found that over half of the uninsured said that they planned to sign up for coverage in the next year, but they don't know how or when or where, and that's where we come in to make sure that they're getting the right information from their trusted community partners, the trusted voices that they rely on to get information about their health coverage and their health care. So next slide. Who enrolled last year? Well, we did find across the board, no matter what we asked about, those who enrolled knew more, whether it was about financial help, how to get enrollment help, free preventive care, not being denied for pre-existing conditions. Those who enrolled absolutely knew more. We know some of them were learning that through the enrollment process, but there is some chicken and egg here, but having information really positions the consumer to take the best action. So what did we learn about those who didn't enroll? Next slide. Those who are uninsured, they are open to getting coverage. They want coverage in the future. This is based on a survey that we fielded directly after the end of the last open enrollment period. And about a third did try to enroll, but ultimately didn't choose to. The main barrier, as we can see here on the lower right part of the slide, is that only 1 in 5 knew about financial help. If we can increase that awareness of financial help, we are confident that we'll get more people across the finish line. So how is our messaging this year different than last year? Financial help, yes. Promoting help with the process, yes. Enrolling in coverage, leading with security and peace of mind, making sure people have the facts and they're not getting bogged down by the politics inherent in this issue, really important. But some key things are changing, and I actually want to walk through those in the slides to come. So the next slide really breaks down our approach to talking with consumers. First, you always want to address the misconceptions. Make sure that they know that financial help is real. Make sure that you ground that in some facts about what it means. Nationally, 4 out of 5 marketplace enrollees got financial help, but there are statistics available for every single state. And if you need help finding those, we're happy to pass those along. And then what's the average cost of coverage to the marketplace for those who are getting financial help? Nationally, that was $82 a month. That's a pretty compelling number, and that really breaks down how real financial help is and how much more in reach health coverage is than they might have thought. Secondly, describe how, when, and where to sign up. Again, fill that information gap. Give them the key dates. That's really the most important thing. Make sure they're encouraged to take action as soon as possible, and then connect them to free in-person help in their community. Finally, if they're still not convinced, explain the cost of going uninsured. Obviously, consumers can face significant medical debt if they have bad luck, they get in a car accident, they have an unforeseen circumstance. But the population you all are trying to reach is probably much more acutely aware of the need for health coverage and the cost of getting health care when they don't have coverage. And then finally, to close the deal, sometimes sharing details about the fine, particularly the degree to which the fine is going up this year, might really be that last piece of information they need to be convinced. So before I turn it over to my colleague Sophie, I just wanted to wrap things up with a couple of tools that Enroll America has created that we want to encourage you to use, to embed on your website, to co-brand, to do whatever you want to really make sure that people know that these are available and connect to coverage. So the first is what we call our Get Covered Calculator, and this is very hot off the presses. We have just finished making some final tweaks to it, and it's available at getcoveredamerica.org. You've got the link there, and you should be able to find it from our homepage as well. It's an embeddable calculator. You can co-brand it so that your organization is featured on here. This example I have on the left here is from Ohio Food Bank, but your organization could appear here if you wanted it to. And what it is it takes basic information, zip code, household income, and a little bit about the people in the household and who's applying for coverage, and gives them a range of costs, what they might pay for coverage through the marketplace. It factors in that tax credit and gives them from sort of the lowest cost plan to a silver level plan in their state, just to give them maybe that extra information they need to feel like, yes, this is in reach, I should apply for coverage. The other tool is new this year. It's our Get Covered Connector, and this is really a tool that we built on something that we did last year. We had a help finder last year where you put in your zip code and it gave you a list of the people in your community who were certified to provide application assistance, free application assistance. But this year what we've done is build on a successful practice that we observed in North Carolina during the last open enrollment period, and really linked up not just finding sort of the name of an organization and their phone number, but giving individuals the capacity to schedule an appointment with that assister online. We're working with assister partners around the country so that the schedules are live and consumers can immediately schedule an appointment. This also allows you, if you're doing outreach, if you found somebody who wants to schedule an appointment either to get help with renewal or to enroll for the first time, pop in your zip code, you can get a list of those assisters, and there might be one available who has an appointment already uploaded into this tool. If you find information here that's inaccurate, we definitely want to hear about that. We want to make sure we have the best, most accurate list out there. We've done a lot of work around the country to make sure that we have a rich tool. I think that the Find Local Health tool on healthcare.gov is good. Ours has a lot more locations, more enrollment events, more places where people can get help. So we really feel pretty confident that this is a robust tool, and we hope that it's useful to you in your work. With that, I want to turn it over to my colleague, Sophie Stern. She's the Deputy Director of the Best Practices Institute here at Enroll America and leads our health insurance literacy portfolio. Oh, I'm sorry. I am not turning it over to her yet. Thank you for that prompt. We're doing a little bit of chat now. I'm supposed to have other questions about the information I presented.
Great. Thanks, Jennifer. This is Molly. So actually at this time we do not have any questions. So we will turn it over to Sophie, but please, I encourage participants to throw out any questions that you may have, and we will address big, small, specific, anything that you want to know, throw in my way and we will cover them. So Sophie, I will hand this over to you now.
Great. Thank you, Molly. Good afternoon, everyone. Good morning to those who are calling in from the West Coast. I'm very happy to be here with you today to talk about health insurance literacy. You can go ahead and go to the next slide, please. Okay, so today we don't have a ton of time to go over health insurance literacy, but we do want to address a few key points. That is why health insurance literacy matters, some concepts consumers are struggling with, and how to help. Again, because we don't have a ton of time to get into the weeds on some of these complex concepts that consumers are struggling with, I will point you to some resources so you can follow up after the call, and of course you can always reach out to us here at Enroll America if you have any questions. And last, I'm going to try and manage some expectations for this current open enrollment period. Next slide. So some of you on the call may be familiar with health insurance literacy. Others may be more familiar with financial literacy or health literacy, but health insurance literacy is really at the intersection of these two concepts and pulls from both. In 2011, an expert roundtable was convened, and they actually coined the definition of health insurance literacy. And I typically don't like to read out definitions on webinars, but I think it's helpful just to hear this so we can all be on the same page. And they determined that the definition is that health insurance literacy is the degree to which individuals have the knowledge, ability, and confidence to find and evaluate information about health plans, select the best plan for their financial and health circumstances, and use the plan once enrolled. So now that we've kind of defined health insurance literacy, we can go to the next slide. Because what we see is that health insurance literacy levels are very low, specifically among young adults, those without a college education, and those that are uninsured. A recent Kaiser Family Foundation survey that was released this month found that those who were uninsured incorrectly identified what a health insurance premium is at a rate of 26 percentage points higher than those who have
insurance. So, I mean, this is interesting if you think about this. Maybe one of the best things we can do to address gaps in health insurance literacy is getting people enrolled in coverage so they can use it and become more familiar with it. But we do see significant gaps in knowledge among those who are enrolled as well. There was also a finding that 44% of in-person assisters encountered individuals who did not know how to use their health insurance. So we are aware that there are gaps in knowledge, and there are also gaps in tools to address those gaps in knowledge. Some specific concepts beyond premiums that uninsured individuals struggle with are calculating out-of-pocket costs, the definition of formulary, which is particularly relevant for individuals living with HIV and AIDS, knowing that they have a right to appeal a decision that has been made by their health insurance company, and deductible. So those are some of those complex terms that individuals are struggling with, and rightfully so. They're complicated. So in all of this, what is the enrollment community's role? Well, we want individuals to get covered and stay covered, as you heard Jenny talk about during her presentation. And here at Enroll America, we have found that there is a direct correlation between individuals who have more information about the Affordable Care Act and health insurance and their likelihood to report that they will keep coverage or renew coverage. So let's take a closer look. Enrollees that felt like they had enough information about the ACA and health insurance also reported being very confident or somewhat confident that they could pay their premiums at a rate of 30 percentage points higher than enrollees that reported not having enough information. So this means, as you know, for those on the call, that if you pay your premiums, you can keep your coverage. So this is really important, this connection between knowledge, health insurance literacy, and the likelihood that individuals will stay enrolled. Next slide. We also found that enrollees that felt like they had enough information about the law also reported that they plan to renew their coverage at a rate of 17 percentage points higher than enrollees that did not have enough information. And again, this aligns with what Jenny mentioned, is that people do plan or anticipate to renew their coverage, but they do need more information about when they can do this. So they need to know that it's currently open enrollment and they can enroll in coverage through the marketplace through February 15th. Next slide. Okay, so what is it that consumers need to know? Well, there is quite a bit on our wish list, and this is our wish list because I think as we think about what we can accomplish as an enrollment community for this open enrollment, that it's not likely that every consumer we interact with is going to come out on the other side of open enrollment knowing these concepts. But as an enrollment community, and we can build programs and initiatives around this wish list to help orient us as we continue to do this work in the years to come. So consumers really need to know why health insurance matters and how it works. I think individuals living with HIV and AIDS may be very aware of why health insurance matters, but may be less familiar with how health insurance works. Individuals need to know when and how to get covered and how to renew coverage, so that is our role to get those messages out to the community. Individuals need to know that financial help or low-cost coverage is available through the marketplaces, Medicaid, or Ryan White. What we saw is that financial help was one of the biggest motivators to drive people to explore their options through the marketplaces, but that a significant portion still are unaware that financial help exists. Individuals also need to know how to find a plan that meets their needs and budget. Individuals living with HIV and AIDS definitely need to know about drug coverage options available. What is the co-payment associated with the plan and other cost-sharing arrangements? And as Molly mentioned, how to avoid plans that may disqualify them from receiving outside assistance, such as Ryan White wraparound services. It's also important to note that we've seen a 25% increase in marketplace plans that are available to consumers. So while competition is good, it has the ability to drive down prices. We also know that sometimes more options can be more confusing to consumers. So it reemphasizes the importance for in-person help to help people identify, which plan really does meet my needs and budget. There are a dearth of resources to help consumers with this process outside of that in-person assistance relationship. But many national stakeholders, as well as stakeholders at the state level, are thinking through what types of tools and resources would be most beneficial to consumers. Next slide. But the bottom line is that consumers really need to know where to get help. It sounds like as Molly mentioned, for individuals living with HIV and AIDS, that they should really be speaking with their local programs, go through the Ryan White office to make sure, what marketplace plan that they're looking at will allow them to receive those services. But Jenny mentioned our Find Local Help tool, where you can enter your zip code and find in-person assistance in your area, and you can actually enroll online. So this is a very important feature as we think about what needs to happen during this next open enrollment period. We really need to be connecting individuals to in-person help. Next slide. So for those of you who are working with consumers on health insurance concepts, if you're providing direct assistance or programming around health insurance, we have a health insurance literacy resource hub. The goal is that we don't want partners to have to reinvent the wheel. A lot of good materials are available out there, and we're trying to warehouse these in one place, so you can go ahead and visit this web page and just grab whatever you need that's most helpful to you. And depending on what your organization is working on, I think you will probably find some materials that are helpful to you. We also have a health insurance literacy listserv. So if you're interested in being a part of a community that's sharing information back and forth about new health insurance literacy materials and sharing questions or things that you have found to be helpful as you're doing this work, we would love to have you, and you can email me directly. My email address is on the slide. It's stern@enrollamerica.org. And with that, we can take a few questions or move on to Dave.
Great, thanks, Sophie. We do have one question here that I think any of you guys could answer. So could you please address how premium tax credits work?
Sure. Yeah, I think that either Jenny or I can take that. So an individual enrolling through the marketplaces may be eligible for financial help, which is a tax credit or cost-sharing reductions. If they're living in a state that has expanded Medicaid, they're eligible for this financial assistance if their income falls between 138% or 400% of poverty. If their state has not expanded, they'll be eligible for this financial help if they are between 100% and 400% of poverty. And what this really means is that they can receive tax credits to help pay for their premium payment. They can receive this financial help in advance, so they can apply it to their premium payments each month to make it more affordable, or they can take it at the end of the year in the form of a tax credit. I think it's important to note that this is not a cash benefit that goes directly to the consumer. This tax credit goes to the health insurance company, and then the health insurance company takes that into consideration and then only bills them for the remainder of the cost. And Jenny, do you have anything to add?
Yeah, I mean, the one thing that I think that's a perfect summary. I think the one thing I would add is that you really should think of the premium tax credit. It's basically like a discount. There are a lot of moving pieces on the background to figure out, based on your income and who you are, what your, quote, discount is. But at the end of the day, that's a dollar amount. And the consumer takes that dollar amount and then can purchase any coverage that they want that's available through the marketplace. But they're going to be responsible for the difference between the premium and their sort of discount chopped off the top. So even though calculating the premium tax credit has to do with silver plans, and getting cost-sharing reductions are only available if you enroll in a silver level plan, you can take your tax credit and buy any coverage you want on the marketplace. And for folks with really high healthcare needs or chronic conditions, they might find that a more generous plan is more to their liking, or covers their needs in a better way. They can definitely use their premium tax credit to make that coverage more affordable.
Great, thank you so much. I think at this point we'll send it over to Dave, who will be talking about best practices on the ground.
And Dave is our state director in Illinois, so he has a lot of wonderful lessons learned from the ground to share out with everyone on the call.
Great. Do you got me? Can you hear me, folks?
Yes, we can, Dave.
Great, thanks. Well, thanks for having me. And this has been great, and I'm excited to share with you some best practices from the ground. And certainly, my perspective, my personal perspective is from Illinois, but I think some of my colleagues around the country share in these best practices. And certainly, there are a ton that we can go over. I've just chosen a few. So, with that, I just want to quickly share with you a little bit about our Get Covered America campaign and the field program that we operate. We operate in 11 different states, and they're listed here. I'm not going to read them off, but if you don't see your state there, don't worry. We have a state assistance program that helps with the rest of the states around the country with with coalition table meetings and engaging partners to bring the right tools and resources and best practices to those states. So I want to just quickly talk here about best practices and partner engagement, really, bringing everybody to the table to maximize resources. Some earned media, or in other words, free media, and some key components for outreach, which is really the nuts and bolts of our field campaign. So in essence, this is a all hands on deck approach. There is no one organization, one government entity or non-government entity that owns this space. There are stakeholders from elected officials all the way through to regular everyday Americans that are engaged in this effort and want to be a part of making sure that their communities get covered and stay covered, that want to be a part of delivering the key messages around financial assistance and helping to reach those who need this information the most, and those are the remaining uninsured or underinsured in our communities. So essentially, establishing partnerships and getting that buy-in from like-minded organizations is really key. Again, it's not just organizations that have received grant dollars. A good example is the faith community. The faith community is very invested in making sure that not only their congregants, but their communities in which their congregations live are covered. And they are very, very invested in that process and have worked with us very closely here on the ground in Illinois and in other states to make sure that they're spreading these important messages and helping us to get the word out in an effective way, which I will share during the best practices for outreach. And I think what something is key to remember in this is that in that sense that no one organization or one entity owns this space, is that we're greater together, and we can share the load. We can maximize our resources by bringing different things to the table, and we can share the credit in the success. And building coalitions and having regular, ongoing communication with those coalitions to put on awareness-raising events, to enrollment events, to educational opportunities, to health insurance literacy summits, like disseminating the information that Sophie was talking about earlier, is really key. And we've seen some success here in Illinois in that space, and are excited to continue to do that, to share and to educate the community around how to actually use their insurance that they've signed up for. Earned media is a term that many folks really understand, and a term that some don't. So I'm going to just go and assume that not everybody knows what the term earned media means. But the way I think about it is that it is media that is generated by your hard work rather than something that you pay for. So whereas an ad on the TV or the radio might be something that you need a paid budget for, earned media is a way to engage local press outlets to take interest in what you're doing. And we've seen great success in staging these kinds of events, press conferences, story sharing with the media, personal stories about folks that have enrolled, to really help drive the conversation, around financial help being available. to drive the conversation about being able to get help online, by phone, or in person at no cost, and to really let folks know the importance of not only the open enrollment period, which started this weekend and ends on February 15th, but to really understand how it helps them in their day-to-day life. And these earned media opportunities also help elevate the issue, but they also help elevate events. And so something that we've taken notice of is that if we have an earned media event a day or two before a big enrollment event or a big educational opportunity, the turnout at those events really is bigger. And of course, then we're reaching more people. We've also noticed that people really get their information from local news outlets, be it their local paper or local TV news outlets. That's where they're getting most of their information. So it's critical to engage those outlets in helping to drive this conversation forward. And then I think the biggest and most effective best practice that I can share with you is about our follow-up program. And some folks call it a CHASE program. I like to refer to it as our follow-up program. And it is the most effective way that we've been able to see moving the needle. And I'll explain a little bit about it. This ability to talk to people about what healthcare means to them one-on-one with our staff and volunteers, engaging the community where they live, work, and pray, and shop, and play is where we've really engaged consumers in a conversation about why healthcare is important, the financial help that's available to them, where they can get in-person assistance, and where there are regular, reoccurring opportunities for in-person assistance or learning more about what their options are. And there's a big difference between raising awareness by sending out smoke signals or using flyers than in the way that we do it, which is how we do our follow-up program. Next slide, please. So it's used with this tool. We do it with using this tool. It's called the commit card. And the commit card helps us to drive a conversation with a consumer when we meet them on the street or at church or at their school, to help them understand, first of all, those key messages around financial help and in-person assistance, et cetera. And then asking them if they want us to follow up with them. And if they do, we collect their basic information, name, address, email, phone number, and follow back up with them repeatedly until they've told us that they've gotten coverage. And it may seem simple, and it may seem hard to do, but we have seen this tens of thousands of times across our state, where people are willing to share this information and want to be contacted. And we follow back up with them with a telephone call to let them know about where they can get in-person help for free. That greatly contributes to their success of enrollment. Next slide, please. So you can see here, if you just did, there we go, thank you, that by following up with consumers, we've seen that often we double, triple, and quadruple the likelihood of those consumers getting enrolled. And I think what's interesting here is the numbers speak for themselves. But just anecdotally, we had several events going on here in Chicago and around Illinois over the weekend, as many of your states did. These follow-up calls, we were calling through our folks that we've been engaging since the end of last open enrollment period to let them know where they can go to get help on the first day. And the places where we did those follow-up calls saw great success in consumers coming to ask questions to in-person assisters or to get enrolled on day one. And in other events that weren't promoted in that way, didn't necessarily see as much success. So that's just an anecdotal evidence about this particular weekend, but I think it speaks to the larger issue that this follow-up program is really key to making sure folks have the information that they need. And you know, we've seen that. I think, you know, another thing to kind of remember here is the reoccurring spaces. That it's important to be flexible where we can have in-person assistance, but it's also important to be regular, especially when we're serving sort of hard to reach and transient populations, as many of you may, to know that there is a regular enrollment opportunity at the nearest public library or at a church that also offers meals on Wednesday nights or Saturday afternoons or whatever it may be, that there's also enrollment opportunities in that same space, really helps people to know about where they can receive that help on a regular basis. And with that, I'd like to turn it back over to Molly.
Thank you so much, Dave. So we have some questions here. So first one, how soon after the consumer pays their first monthly premium will they receive health insurance? And perhaps along with that, you know, sort of the time frame of choosing a plan, paying for the plan, and then when does that coverage begin?
Hey, this is Jenny. I can chime in there. So we've got obviously the general timetable that I talked about earlier. If somebody chooses a plan by the 15th of the month, then their coverage would be effective the 1st of the following month. But it is important, and I'm glad that somebody asked, that that consumer does pay their premium. And one of the most important things, again, that consumers can do after they enroll is to contact that plan, follow up, confirm that they're enrolled. They should be getting a notice in the mail from their plan that provides information about their first premium. But they are going to need to pay the premium before the coverage is effectuated. In some states, you may be able to pay your premium online when you choose a plan, but that isn't the case across the board. So consumers are really just going to need to navigate that sort of case by case.
Great, thank you. We have another question about, so we talked a little bit about the premium tax credit assistance, but can we talk, can we expand and maybe talk in detail about the cost sharing assistance and how that differs from premium tax credits?
Sure. This is Jenny again, and again, I'm glad that somebody asked because I kind of slid that in when we were talking about the tax credit and wasn't probably completely clear. So in addition to the premium tax credit that consumers can get if their income is below 4 times the federal poverty level to lower their monthly premium costs, folks with incomes below 250% of the federal poverty level can get some relief on their out-of-pocket costs when they actually go to see a provider. So they will have they would likely have lower deductibles, lower coinsurance, and lower sort of cost sharing when they actually go to get health coverage. Now, the really important thing to keep in mind for those who are eligible for cost sharing reduction is that they have to enroll in a silver level plan in order to get that reduction. In most cases, that's going to be the most coverage for the most affordable amount of money as well. It's not as though they're foregoing a gold or a platinum level plan in order to get cost sharing help. The act of getting that cost sharing help actually sort of elevates the value of the plan so that they are getting a plan that is at a higher tier essentially, but their cost sharing is lower. And another thing to keep in mind here is that if a consumer is eligible for that cost sharing help, then that's just going to automatically be what the silver plans look like that they choose from. They don't have to take any additional steps to activate that cost sharing reduction. They just need to take a really close look at those silver level plans and make sure that they're keeping those in mind when they make their plan choice. Does that make sense? It's a confusing concept, so if folks have follow-ups, please chime in.
Great, thanks, Jennifer. If we do have follow-ups, I'll definitely raise those again, but moving on to a different question. So if a person signs up for a plan on their own and then either a provider or a navigator or someone within an organization realizes that this is not, or they themselves realize that this is not a good plan for them, can they change their plan if it is still in the open enrollment period?
Yes, no, that's a great question, and that's something that's new this year that wasn't available to consumers last year. That yes, if they enroll in a plan and they realize maybe it isn't the best fit for them, they have the option to switch plans as long as it is in this open enrollment period, so before February 15th.
And I would add one caution to that, which is that it's excellent that consumers can change their plans up until the 15th, and we really appreciate that change this time around. It's important for consumers to keep in mind that if they are enrolled in a plan that started coverage January 1st and then they want to change plans, if they're changing from one insurance company to a different insurance company, their deductible and out-of-pocket max sort of calculations will reset. So if you go from you're in insurance company A for the first month of the year, you get some services, you spend some money that goes towards your out-of-pocket max. If you switch to insurance company B starting in March of that year, all of that resets so that you're going to have to spend again to get to your out-of-pocket max. So I just want to keep that flag in mind. That's a great flag.
Great, thank you. Next question, can we talk a little bit about the catastrophic plan? So we've talked about bronze, silver, gold, platinum, but can we speak to this plan specifically?
Sure. So, I mean, the catastrophic plan is an option for certain individuals who are seeking coverage through the marketplace. It is a skinnier benefit than the silver, the other plans that are available. So I would take that into consideration if you are an individual or an organization who is helping individuals apply through coverage through the marketplace. But it is, skinnier benefit, but also lower cost. So if someone isn't anticipating getting sick or doesn't have a lot of healthcare needs, that might be an option that they want to look into. But generally, what we've seen that sometimes the catastrophic plans can be the same cost as the bronze plans, and the bronze plans do offer a little bit more robust coverage. So just something to take into consideration, and definitely it's going to vary marketplace by marketplace.
Great, thank you. The next question is one that we've heard a lot, and it's very important. So if a state did not expand their Medicaid program, what are options for financial assistance for those who are low income, but because the state did not expand Medicaid, they do not have access to this program?
Sure, I can chime in here. This is Jenny. So in states that did not expand Medicaid, generally the financial help available through the marketplace starts at the poverty level. So if someone's income is at 100% of the federal poverty level or higher, they will qualify for financial help, for a premium tax credit to lower their monthly costs for getting coverage through the marketplace. If their income is below 100% of the federal poverty level, unfortunately they fall in what we refer to as the coverage gap. These individuals don't have access to financial help for marketplace coverage. They could purchase coverage through the marketplace, full freight and pay the full cost of the premiums, but obviously these people have very low incomes, and for most that is absolutely not financially realistic. Typically, we encourage those individuals to connect to coverage through a health center, through, I guess, for your population, probably a Ryan White program. Those are good options for those folks, but there is a coverage gap for those individuals. Now, it's true that certain immigrants can qualify for a tax credit if their income is below 100% of the federal poverty level. This is just due to a funny way that the law shook out after the Supreme Court rulings in 2012, but there is financial help available for small groups of immigrants who might otherwise fall in this coverage gap. But I don't want to talk a whole lot more about that because the rules get pretty complex.
Great, thank you so much. And I also just want to chime in relation to individuals in states that didn't expand Medicaid and who are living with HIV. Many states' Ryan White and ADAP programs do have financial assistance to help pay for a premium and pay for medications if they are not, if they are unable to receive Medicaid assistance and are unable to afford a plan on the private marketplace. So again, I know I sound like a broken record saying this, but please, please contact your local Ryan White and ADAP office, and they will absolutely be able to help you. We have a question regarding exemption. So when applying for an exemption, do you need to file one exemption application per household or one application per person in a household? Does anyone know that?
So my response to that is a little bit of a pivot, but it is to a resource that I can even share out via the chat feature if that's helpful. Depending on which kind of exemption a consumer might qualify for, and they might qualify for more than one kind of exemption, there are different rules about where they have to file that exemption, whether they go to the marketplace, whether they need to do that through the IRS, whether they need to do it in advance, or if they can wait till they file their taxes. The map to sort of an exemption is one with lots of arrows and lots of lines. But we will go ahead and send around a one-pager that shares some of this basic information. You should be able to apply for an exemption for the entire household if that is the case. But again, different exemptions have different pathways. So I'll go ahead and send that link to Molly, and she can share that with the group.
Great, thank you so much, and we'll make sure to get that out. Another question, has anything changed in terms of the policies around undocumented individuals and their participation or ability to access the services and health insurance through the marketplace or Medicaid?
Well, no is the short answer there. Undocumented individuals are not eligible to purchase coverage through the marketplace. They're not eligible for financial help for coverage through the marketplace, obviously, and they're also not eligible for Medicaid except in emergency circumstances. Emergency Medicaid continues to be available for those that qualify.
Great, thank you. We do have a question here. Does Enroll America have offices in every state?
Dave, do you want to take that one on?
Sure. The answer is unfortunately no, not in every state, but in 11 different states we do have offices, and we have regional contacts for the rest. So if folks are interested, we can get a list of those contacts for each state. The places where we have a field campaign, like the one I was describing, are Arizona, Florida, Georgia, of course Illinois, Michigan, New Jersey, North Carolina, Ohio, Pennsylvania, Tennessee, and Texas. And we do have contacts for everywhere else, so we're happy to get those to you. And of course our headquarters in DC, I should never forget.
Thanks for not forgetting us, Dave.
You bet.
Great, thank you, Dave. So Dave, I have another question for you. So what are some tools that that can be used to make sure people are prepared to make the best choice for their coverage? For example, what questions should we be asking consumers to assess their readiness to enroll, and perhaps assessing their health needs or any sort of concerns that they personally may have that should be taken into account when choosing a plan?
Sure. I mean, I think.
Oh, go ahead. Go ahead, Dave.
Okay. I mean, maybe we can both take this. I think from an outreach perspective, you know, our role really is to just assess whether somebody needs coverage, and mobilize that person to sit down with an in-person assister and go through those specifics that are personal to them and their family and their health needs. And I can turn this over to Jenny or Sophie to get into the specifics around what's important. But the first thing that we want, that I always tell people is make sure your doctor, your physician, and your pharmacy, the places where you go receive health care, accept the plans that you're considering. But I'll bump it to you guys for a little bit more in-depth answer there.
No, Dave, I think that that's right on the mark. It's providers, especially for individuals living with HIV and AIDS, being aware of what drugs that are needed and making sure that the plan that they are looking at does cover those drugs. We know that it's a little bit difficult, or at least it was the first time around, to always find the formularies that were associated with the plans. We're hearing that it's a little bit better this time around, but that's, again, why in-person assistance is so critical, to make sure that there's someone there who can sit down with you and really kind of search through each plan to make sure that you are making the best option. Another thing I think to take into consideration is your budget. How much can you actually afford to pay in premiums each month, and how does that compare with your potential deductible or the amount that you're going to be paying in cost sharing when you actually use your health insurance and go see the doctor. Balancing that out is pretty important, especially for individuals who anticipate using a lot of healthcare services throughout the year. As far as resources go, Illinois actually has a wonderful plan compare tool that was developed by Consumers Checkbook. Definitely recommend logging online and taking a look at that. But for those not living in Illinois, healthcare.gov does have their window shopping tool that was made available this year, which is quite good. Individuals can kind of go on and shop before actually going through the application process. But on the Health Insurance Literacy Resource Hub, which I mentioned earlier on, there are some tools that assisters can use or consumers can use when they are going through that plan selection process. There's a worksheet that was developed by the Center on Budget and Policy Priorities that is quite helpful, and some other resources available. So I do recommend you check that out.
I just want to jump back in here real quick. This is Dave. Around just that piece of the question that said assessing a consumer's readiness to enroll. If somebody doesn't have health insurance, they need to be ready to enroll. It's not really an option for the reasons like needing to just get your ongoing and regular health needs met, but also there is a fine, and consumers need to be aware of that. They need to be aware that their 2% of their income will be assessed at as a fine or $325, whichever is greater this year, and it's something that folks need to understand. So when we say to someone, you're currently insured or looking to get better coverage, they're ready to enroll, and it's our job while we do outreach is to make sure they know where they can go to sit down and ask those questions, like the ones we were just discussing.
Great, thank you, Dave. So we've got about 10 minutes left, and so I'm going to open it up. If anyone else participating on the webinar has any last-minute questions, please send them over. But if anyone, Jennifer, Sophie, or Dave, wants to offer anything else up, sort of wrapping up comments, or one more thing that you thought about that maybe you didn't get to in your presentation, we would love to hear about that before we wrap up this webinar.
Well, I mean, the one thing that I would say is no matter where you are in the country, as Dave mentioned, we have a presence. We are trying to be as helpful as we can to be supportive of the work you're doing. And one way that you can initiate that relationship if you haven't followed Enroll America in the past is just to go to enrollamerica.org. That's the sort of partner-facing part of our organization. And you can sign up for our email newsletter so that you can at least start to get those updates of the materials, webinars, and other ways that we can support you there. If you want to learn more about the campaign, our consumer-facing website is getcoveredamerica.org. I think hopefully these things kind of came out over the course of the presentation, but just wanted to drive that home. You can check out getcoveredamerica.org to see some of the messages and tools that we're directing at consumers and assisters to make all this process go as smoothly as possible over the next 3 months.
Great, thank you. And then, you know what, we have one more question, and I think after that we're probably going to wrap up. So sort of going back to the premium tax credits, can someone describe the grace period associated with those?
Yes, great question. So individuals who receive a premium tax credit can choose to do so in advance. So they can, as I mentioned, they can apply that tax credit to their premiums monthly. So individuals receiving the advanced premium tax credit have access to this grace period, or what they call a grace period. And that means that if they do not pay their premiums for up to 3 months, the issuer cannot cancel their coverage. What it does mean, though, is that in the first month of that grace period, a consumer will continue to have their health care services paid for by the issuer. In the second and third months, the consumer is on the hook for any health care services utilized. So the provider has the option to bill the consumer for services utilized that the issuer is no longer going to pay for. At the end of that 3 months, if they do not repay their premiums and continue to pay their premiums, their coverage will be canceled. But that grace period is available to individuals who are receiving advanced premium tax credits through the marketplace.
Great, thank you so much. So with that, we are going to wrap up today. Thank you, excuse me, so much, Jennifer, Sophie, and Dave, for offering us this fantastic information. Again, we will have the slides available on hivhealthreform.org, and they were also emailed to all registered participants this morning. And lastly, I just want to finish with another reminder and encouragement for folks to speak up if they're having issues. So if you're having issues with perhaps plans in your state having terrible coverage for HIV meds, please use this form and let us know. If you're finding that there are no HIV providers in networks for plans in your state, please use this form and let us know. Again, this helps us sort of see patterns within states that are emerging, and we can use this to also educate state and federal officials about what's happening, and hopefully then together craft a solution or a way to address these issues. So with that, again, I thank everyone for joining us today. And again, please go to hivhealthreform.org to check out these slides. And with that, have a great afternoon.